So this week we were talking about race, racism, and health disparities. And if you haven't heard this, just a little background about myself. I was going to go into clinical psychology in my graduate career, but working in a healthcare industry and doing research, I realized that a lot of people from minority racial groups had poorer health satisfaction and less satisfaction with the healthcare system. And I knew it couldn't be just race. What was it about just being African American or being white or being Asian that would give you a different healthcare experience? And it really turned out to be it had to do with more of the racial atmosphere and the environment that people were trying to live and thrive in. And so I changed my career path to be public health. And when I think about race, and racism and health disparities, it's so complex. And so I'm just going to share with you a little bit from what we talked about this week in our readings and videos, but also some of the things I've picked up along the way. So when we're talking about racism, we're actually talking about different things: stereotyping, prejudice, and discrimination. Stereotyping are the cognitive appraisals that people have. It's attributing characteristics to individuals because they are in a group. It's based on their group membership. Stereotypes lead to causal inferences, such as they are poor because they drink too much. They are poor because they don't work so much. I've heard all my life Jewish people have money because they take it from people. Asian people are smart because they're Asian. Those are stereotypes that you attribute to maybe one person or a group just because of their group membership. Prejudice is affective reactions. It's unjustified or incorrect attitudes towards individuals or groups based on their group membership. And it brings about this us or them mentality. Examples are having an in-group versus an out-group. There are these different Lives Matter campaigns going on. White lives matter, black lives matter, blue lives matter. Only my group's life matter. Those are prejudicial reactions against other groups. Discrimination is the intentions and behaviors that come from stereotyping and prejudice. It's differential treatment of individuals based on group membership. It's not always intentional. It can be subtle and overt. It can actually be positive for some groups. There's racial profiling, glass ceilings, and age discrimination. So what is race? Race is a term commonly used in physical anthropology. It's these categories of humans that possess traits that are transmissible by descent and sufficient to characterize it as a distinct human type. And originally, race was put into categories of Caucasoid, Mongoloid, and Negroid. But over time, these racial categories have changed. As such, you know that when you can change a racial category, race is not genetic nor biological. It's more of a social designation. It identifies groups and classes that share physical characteristics, common culture, and history. Pure races do not exist. There's no genetically homogeneous population level group. And when we see biological differences between humans, that's a reflection of heredity and evolving within a natural and social environment. So when we hear about Tay-Sachs disease impacting Jewish groups, such as my Jewish group, the Ashkenazi Jewish people, and Tay-Sachs, this disorder that people have to be tested for, it's because of the natural environment they live in. It's not because of their racial category. So if race is not biologically determined, why do we still consider it in research and practice? And that's a big, huge question. I'm asking about race when I do studies and I go to our institutional review board. They're often asking, why do you need to know about race? When we talk about race and we ask about race and we keep track of race, we acknowledge and track the role and consequences of race in institutional systems and environments, such as the criminal justice system, the educational system, our healthcare system, employment and job markets, and even our neighborhoods. When we refuse to acknowledge and measure these consequences of racial classifications, we can never eliminate racial inequalities. Therefore, we must keep track of these things. We must acknowledge them, and we must ask about them. Racism is a system of structuring opportunity and assigning value based on phenotypic, like skin color and hair texture, phenotypic properties associated with race in the United States. Racism unfairly disadvantages some individuals and communities, and it unfairly advantages other individuals and communities. Ultimately, it undermines the full potential of a whole society because it has this wasted human resources. So this week I asked you to read about and also watch a video by Camara Jones about the Gardener's Tale. And she's talking about communicating about racism. And in the Gardener's Tale, she illustrates through metaphor or allegory 3 types of racism: institutionalized racism, personally mediated racism, and internalized racism. So if you have not seen this video, please do so. Institutionalized racism are policies and practices and procedures of institutions that disproportionately and negatively affect racial minority access to quality goods, services, and opportunities. There's differential access to education, housing, employment, medical facilities, clean and safe environments. There's also differential access to information, resources, voice, and control. It is responsible for the association between race and socioeconomic status in the United States. There is initial historical insult. There's this idea that in the video, they talk about the pink flower seeds were planted in rocky soil. So can you imagine going to college or trying to get into college when you have actually been denied a quality education to even bring you up to the level that you could be in college? There's structural barriers such as the segregation by boxes of the flowers. So here we have barrios, and we might have places that people live that are underserved. There's inaction in the face of need and societal norms. That's the preference for the red flowers over the pink. Biological determinism, thinking and deeming the pink flowers as inherently inferior to the red flowers because they didn't grow as tall. But you can remember at the very beginning, there's this initial historical insult. So it's not biological, it's a social construct. And then there's this unearned privilege where the red flowers feel pretty fine and deserving of splendor compared to the pink flowers, even though they have not done anything different. They just grew up in a better place. Personally mediated racism are the lack of respect and poor services and no service that people may get just because of who they are. There might be suspicion, avoidance, devaluation, surprise at competence, stifling of aspirations, scapegoating, and dehumanization, police brutality, sterilization, and hate crimes just because of the racial group you are from. It's acts of commission as well as omission. Sometimes the interface between personally mediated and institutionalized racism is blurred. People maintain the structural barriers or fail to act, supporting institutionalized racism, and their personally mediated acts of racism are allowed to continue because they are supported by institutions and condoned by societal norms. Personally mediated racism is the kind of racism you hear about most often, where people act in negative ways against others. And then finally, the third type of racism that Camara Jones talked about was internalized racism. This is the person themselves from those groups accepting negative messages about their intrinsic self-worth, embracing whiteness. We've seen in lots of cultures where people will try to have the lightest skin possible, devaluating themselves, using racial slurs against their own groups, rejecting their ancestral cultures. Resignation to the idea that they are less than others. Helplessness and hopelessness, which is what we see in terms of dropping out of schools, not voting, and taking part in very risky health behaviors because people just don't feel like they're worth it. Internalized racism is not something intrinsic, but reflects a system of privilege. It reflects societal values, and it erodes individuals' sense of value and undermines collective action because, as we saw in the video, the pink flowers are so busy wanting to be red that they don't come together to create pink solutions. So what are the consequences of racism? Here we can see, even in the Time magazine, the tragedy of Detroit. I worked in Detroit for quite a bit. It's an amazing city, but there was a lot of white flight. People who had power, people who had differential access left the city, leaving people who had nothing, leaving people who had grown up in the rocky soil to begin with and hadn't had a chance to come together. And now we're seeing people are coming together. But the consequences of racism are differential access to education, jobs, housing, and healthful foods. There are often food deserts in places where there's the consequence of racism. Another consequence is lower socioeconomic status. And we know that without money, without funds, without wealth, people don't have power. There's hardly a chance to move forward. There's targeted and concentrated alcohol, tobacco, and fast food or junk food places. These are cheap ways that people can find relief, and they are targeted toward people who are from groups such as young people or people who are having lower access to education and jobs and housing. These are targeted in these areas where people are needing. There's a lack of health-enhancing resources, and there's exposure to unsafe conditions. So when I lived in Detroit, I worked on a project called Community Action Against Asthma in Detroit because of all the trucks that go between Canada and into Michigan. The air quality was terrible, and those trucks and the big roads went through minority areas, places where people who didn't have a lot, people who had been discriminated against for so long, that's where those roads were. And so I did interviews with parents of children who had been suffering from asthma. And one of the parents I interviewed said about her child, so the neighborhood with most of us who are people of color, we live in neighborhoods where there is no regulation on dumping, on smoke, and on fumes. And so she knew that just because of the group that she had been a part of, she was designated to a neighborhood that would allow unsafe atmospheres for their children and the people who lived there, just because her color and where she lived. So next week, you'll be focusing on neighborhood health, and you're working on your posters. And I'm sure that none of the neighborhoods you're looking at look like this one, but this is a neighborhood in Detroit. And I'm asking you in that week to read something called Broken Windows. It's a study that I'm asking you to read. It was a neighborhood health assessment that was using some of the techniques that I'm asking you to use in your neighborhood assessment. In theirs, they found that STDs, sexually transmitted diseases, were actually related to the environment, to the neighborhood in which people lived. And this was beyond, above and beyond whether people were living in poverty. So what they found was when people lived in a dilapidated area, they started to lose hope, and they started to not take care of themselves at all as well. And so they started taking part in risky health behaviors. The idea is that while the individual is important, we need to move beyond the individual level blame and interventions on just individuals to start addressing social and environmental contexts. So I'm going to stop here, and we'll have part 2 to talk more about microaggressions and other things that have to do with racism and discrimination.